So we had a patient that came through, a new mother, and she was sitting in the pool holding her brand new baby, talking to her family. And all of a sudden she couldn't talk and she had to set her baby down because she was starting to get weak. So she came to the hospital. We identified that she had a blood vessel blocked in the brain, and we were able to restore the blood flow. And in a couple of days, she was able to go home back to normal and help take care of her new baby. Stroke is either a loss of blood flow to the brain by blocking a blood vessel, or a blood vessel that bursts and then bleeds into or around the brain. A way to know if you're having a stroke is to look for the symptoms associated with the phrase "be fast." So balance, eyes or vision, face, arm, speech, and then T stands for time. The sooner we can provide care and potentially recognize the problem and treat the problem, the more likely that you or your loved one is going to do well. A lot of interventions center around recognizing you had a stroke and then putting you on the appropriate medicines to prevent another one, or do procedures to retrieve the clot from the blood vessels in the brain. So our stroke program is really exciting. We're on the cutting edge. We do research. We have neurologists and neurosurgeons who take care of patients before they have problems and also once they do. There are two types of stroke, ischemic and hemorrhagic. And the hemorrhagic portion of those types of problems are where the blood vessels break open. There are procedures that we can do to either prevent that from happening if we recognize the problem early, or if you present with symptoms, then we can potentially treat it to prevent it from happening in the future. A very unique thing about our program is that we have dual trained neurosurgeons. So that means that we trained to treat blood vessel problems both through open brain surgeries and neck surgeries, as well as through catheter-based treatments through minimally invasive incisions in the neck or the groin. And that means we could do either option. So we're choosing the best option for you when you come to see us. The biggest things that you can do to prevent stroke are to be proactive about the choices that you make. So see your doctors regularly, take the medicines as prescribed, and make the lifestyle changes that are important. And those lifestyle changes include not smoking, eating a healthy diet, and getting a good amount of exercise. The good news is that technology is getting better every day, and we have more and more treatments for patients. So while this used to be a game where we were reactive, it's now one where we're proactive. And so I'm just thankful that patients trust me and my team to help take care of them and help try to get them and their family back to a place that they were before they met us.